let's get into it. Okay, so today we're talking about sleep. And obviously, sleep is one of the biggest frustrations patients have after surgery, especially early in recovery. We know that in our 50s and 60s and 70s, we have trouble sleeping anyway, regardless of whether we're having surgery. And you know you had trouble sleeping when you had the shoulder pain before you needed to have the surgery. So it's difficult, and then we add that on top. And so it's not just about discomfort, it's about pain, it's about fear of movement, it's about us interrupting that healing after our surgery. So we're going to talk about 5 real world tips to help you sleep better, specifically in positions and pillow setup, medication timing, and mindset strategies. So if you would, down below, let me know where you are in your recovery and how many hours you're sleeping now. So that will be interesting for me to know. So everybody has trouble sleeping after surgery. So that's just the normal way it is, unfortunately. We don't like it, but it's just the normal way it is. Why is sleeping so hard? Well, again, as we said, it's not just the pain, it's the worry, the concern that we might shift or move or twist during the night and blow it all up, right? And make everything fall apart, which is unusual, right? That's not what happens. Typically, we know that the sling can feel awkward and restrictive. We know when we're not in the sling, we can feel loose, like something's going to fall off. So that combination of worry, and then we get at night and the anxiety of moving wrong and maybe making the shoulder injury worse or making the pain worse. It's just this anxiety. So specifically in the first few weeks, it's really the toughest. And that's when we have to have all these tricks in our bag to see if we can make this as reasonable as possible, right? To not suck as possible. So not sleeping well early on is normal. It's not a sign that something's wrong. It's a sign that you're healing, right? Sleep challenges are part of the process, not failure of healing. So if you're not sleeping, it's understood. So first question, should I sleep in a recliner or should I sleep in a bed? Which one's better? Well, there's no one that's better. It's kind of what you have and what you feel most comfortable. No one size fits all. The recliners are a little bit easier. They're more upright. They prevent rolling. You're not going to roll out of the recliner. But it is restrictive, and sometimes the recliners can create some back pain and some stiffness and some discomfort over time, right? The other thing with the recliner, if the button or the handle to get you upright is in the wrong part or the wrong side or the side of your surgery, it's going to be very difficult to use. If you decide to go in the bed, then it's very difficult to lie flat. If we talk about the bed, then we're going to have to use some wedge pillows or stack some pillows around us to stay semi-upright because we're not going to feel comfortable lying flat. Tugs on the shoulder makes it really uncomfortable. It's going to be almost impossible to sleep early on lying flat. Also, just quick tip, put a little pillow underneath your knees. That's going to give you a little bit reduction of the back pain too. So we want to keep the recovered arm supported from the elbow to the wrist, right? Not just the wedge, but we need another pillow too. So it's not about where you sleep. It's about how you support your shoulder while you're sleeping and what's going to make you feel the most comfortable. So if you found this video so far helpful, please subscribe to the video. Please like the video. You know that I post every week these tips and tricks in recovery and hopefully a little bit of humor and hopefully a little bit of compassion. So also, if you click the link down below, we have a free pre-op checklist that we can send to you. So if you click on that, we'll get that sent out to you. Okay, the pillow setup that actually works. So what I like is a pillow, regular old pillow that you're going to support your whole arm, right? Not just your elbow and not just your wrist, your whole arm. That's important. And then we put the wedge pillow behind us, right? The wedge pillow behind us, that can really be helpful. So we can get you set up, reclined. We can get the pillow underneath your arm, and then you can actually put a whole bunch of pillows around you if you want to. I think this is actually a hack I like, is that if you get a bed rail, right? We use bed rails for children so they don't fall out of bed. Well, I think that if you're worried about this stability here, you put the bed rail next to you, you put your pillow underneath here, pillows on either side to help prevent you. You get your reclined position with the wedge. That's going to be really helpful. And it's going to be very difficult for you to move, which is okay, and very difficult for you to fall out of bed, which is really okay. So I think those two things actually will be really, really good to give additional support and confidence and let you sleep more comfortably. So this setup helps any sudden shifts or painful wake-ups. Again, it's not glamorous, but it seems to work. And so I would encourage you, the wedge, the pillow, the bed rail. Okay, so here we go. Now, next step, timing, medication, mindset, right? So we don't want to wait till the pain is too bad. So we want to make sure we're taking your pain medicine a half hour, 30 minutes before you go to bed. Probably your pain meds and maybe even some anti-inflammatories. As you know, we have an anti-inflammatory supplement that we sell. We'll put it in the show notes, just so you know. So we want to make sure we take that before you get to bed. We probably want to ice it down before we go to bed. We want to wind down. We want maybe a little tea. We want the lights down. We want to take the screens off for a while before surgery, before sleep, sorry. Also, maybe sometimes a soft blanket over the recovering arm gives a little bit more comfort and eases the anxiety. So try that too. Because people feel maybe exposed or something, right? So if you are recovering, then those are some good ways to help in your sleep habits. And of course, sleep isn't about pain, it's about how your body and mind rest, right? And so we want to talk about the restfulness of that sleep. We want to make sure we get some sleep. And we know that in the middle of the night, you're going to probably wake up and be anxious, be thinking about something, maybe something related to your shoulder, maybe not related at all. So I'm going to give you this little hack that I do when I can't sleep. And this may not work for you, but it works for me. And it's in relationship to some meditation. So in the meditation, oftentimes the beginning of meditation, you check in with your body parts, right? So what does that mean? So that means when I'm anxious and restless and thinking about too much, I check in with my head. I say, well, how does my head feel? How does my neck feel? How does my traps feel? How do my shoulders feel? How do my upper arms feel? How do my elbows feel? How do my forearms feel? How does my wrist feel? How does my hand feel? My fingers feel? And just checking in, and I do that throughout my whole body. And if I'm still a little anxious, I do it again. But really, and again, honestly thinking, noticing the pieces of my body. And for whatever reason, that seems to relax me and helps me to sleep. So that's a tip for you from me. Hope it works. If it doesn't work, sorry. So in the wrap up of this, sleep after surgery isn't easy, but it is solvable and it will get better. And it will get better as time goes on. With the right pillow, setup, routine, positioning, you'll sleep better. Bad nights don't mean bad recovery. Be patient with the progress. Again, patience is a virtue. Be kind to yourself. Just relax and go through the process. And don't forget to download the free checklist and look at the video of the shower hacks, and also look at the most recent video I did on the 5 truths of the first 6 weeks. Those are 2 really good videos that help you get prepared and progress through your recovery. So thank you. And remember, this is a phase. It's not forever, and you're not doing it alone. So I'm here for you. If you'd like, we have a Facebook private group down below in the description. There'll be a link to that as well. So good luck to you. I'm rooting for you, and we'll talk to you soon.